Nuruddin for this elaborate overview. Please, I think he deserves more than this. Can we give him a more round of applause? Before I call the next presenter, I would like to recognize the presence of the rector, Audu Gusau Polytechnic, in person of Dr. Shayau. You are welcome, sir. Next presenter is going to tell us about the prevention, strategy, and control of cholera in our environment. And the speaker is nobody but Dr.Bello Magaji Arkilla, who is from the Department of Community Medicine, Usman Danfodio University, Sokoto. He is also an alumni of this university and a public health physician. Dr. Bello Magaji, you are welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh, and very good morning. It is with great pleasure I'm standing here in front of you to make this presentation on a very important public health issue of concern to all of us in Sokoto, in Nigeria, and in all developing countries. I remain Bello Arkilla, senior lecturer in Department of Community Health, Usman Danfodio University, Sokoto. I'm going to talk about strategies for the prevention and control of cholera outbreaks. I will start with a quotation by an opera composer, a German, Meyerbeer. He said, "May God be with me. May heaven bless this new year. May it be a year of fruitfulness, of peace and prosperity. May it be a year of peace and unity for all mankind. May the world be freed of cholera." This statement was made somewhere before 19th century. There are, next slide. Okay, this is a very unpleasant scene that we all agree that are common sights in our environment in so many places. We look at shops around a gutter, unpleasant look. Dumps, refuse dumps, and someone looking for water in the river. We all have had this experience in the past. I don't know of today's children, but I know I also used to drink water directly from the tap with my hands like this. This is a scene of environmental sanitation drive somewhere in 2016 in Sokoto around the Sultan Palace. Next. It's not working. All right. In my presentation, I'm going to look at why are we doing this presentation, and also what we know so far, key stakeholders involved in cholera prevention and control, the global efforts at control of cholera in the world, some strategies that were put in place and how they are operationalized, the West and Central Africa Cholera Platform, Nigerian efforts, the role of academia, and what me, you, and others can do in fight against cholera in this country. I would like to, what I want us to achieve at the end of this presentation, to understand who are the key stakeholders in the fight against cholera outbreaks in Nigeria, and also itemize some global efforts toward prevention and control of cholera, and review some priority strategies for prevention and control of cholera in Nigeria. Okay, as the first presenter made such a wonderful presentation on epidemiology of cholera, I would like to just add some tips on what he has said. It is important for us to know that cholera is one of the oldest and best known diseases in this world. Despite that, we still have spells of cholera outbreaks happening in developing countries. It is preventable and treatable at the same time. That is why it has been eliminated from developed worlds. A severe form of this cholera can kill within 24 hours if not attended to. I wonder if anybody knows anybody that ever survived 3 episodes of cholera at all. We have evidence-informed guidelines and management guidelines that helps us to manage cases when they occur. However, data is not readily available, as WHO said and Dr. Nuruddin also highlighted. And some of the issues affecting the presentation of this data is obviously a poor surveillance system in most of the developing nations, and also unfortunate fear of international sanctions in terms of travel and economic sanctions for tourism and other related economic activities that countries are afraid of, which makes them to deny having cases of cholera for such reasons. Because if such sanctions are put in place, the countries will be suffering from the double sword of sanctions for their the economic cost of the sanctions, as well as cost of case management, which is a very important and difficult cost issue. It's unfortunate that at every given 10 seconds, a new case of cholera occurs in the world. 47 countries in the world are now affected with cholera, and these are some of the very scary figures. Thinking of 40 to 80 million people are living in cholera hotspots in the African continent, and up to 2.4 billion are without basic sanitation facilities. Over 2 billion also drink water from sources contaminated with feces, and about 844 million people lack access to basic drinking water in this world. As I said earlier, cholera is linked to these 3 major things: crowded living conditions, inadequate and protected water supply, and poor sanitation. And there are other things that we always need to think about. What are the other things that might have supported the continuous occurrence of cholera spells in the world? Persistence, is it that there is possibility that there is persistence of long-term careers beyond what we know? Is it that the cholera organism is freely living within the environment, or in an altered or adapted forms that allows it to continue to live around and also cause unabated diseases? There are possibilities that there are a year-round continuous transmission by subclinical cases or carriers, and also that since we have a large number of asymptomatic people with the cholera, there is possibility that asymptomatic carriers remain within the population and they sustain the spread of the disease, cholera. Unfortunately, we need to know that the current approach we usually have in cholera response is obviously a reactive one, which is more or less an emergency response, rather than the preventive measures that is more important and more beneficial to the larger population than the emergency response, which happens when the disease already happened. Interestingly, preventive measures are known, and they help to save cost and the already scarce. Having said that, I don't know why. Hello, can you? Okay, having said that, most of the reactions, most of the effort we make are usually coming from the health sector, even though health sector is simply one of the so many stakeholders involved in the occurrence of cholera, and also that are supposedly supposed to be involved in prevention and control efforts for cholera wherever it happens. For example, ministries of water resources and its MDAs, ministries, departments, and agencies, are supposedly supposed to be the one providing water resources for us, safe water, and knowing fully that cholera is a function of a failed safe water supply for the communities. Ministries of Environment, responsible for sanitation and other hygienic activities, are also major stakeholders. I deliberately decided to put Ministry of Health at this level because the role of Ministry of Health happens majorly after the cholera has already happened. We look at the Ministry of Education, academia, our research centers, development partners like the CDC, World Health Organization, UNICEF, communities, their leadership, and the general population like me and you, who are also responsible in one way or the other to the spread of the disease and even its occurrence within the community. The media have a lot of role to play, especially now that we have the social media. The role of this social media can never be overemphasized, especially in nowadays. The private sectors, in terms of people who are doing the business of water production, people responsible for food production and food vendors around us, they all in one way or the other contribute to both the spread and also control of cholera outbreaks and many other diseases of interest, public health interest. Civil society organizations and non-governmental organizations also have a role to play when it comes to issues relating to prevention and control of cholera in Nigeria and other countries. I don't know why this... Can you move next, please? Having said this, the World Health Organization in 1992 set up a task force known as Global Task Force on Cholera Control to be able to coordinate a fight against cholera. And the task force has been working round the clock since then, even though there were some breaks in their activities until recently when it was revitalized in 2004. And in 2017, a global roadmap for cholera control was launched towards targeting 2030 for the elimination of cholera in at least 20 out of the 47 endemic countries of the world. And it is also expected that this collaboration or task force works closely among more than 30 institutions ranging from academia, research institutions, non-governmental organizations, and several United Nations agencies to support countries, develop specific plans, and also control measures for cholera outbreaks in their countries. Excuse me, please continue. This collaboration envisions a world in which cholera is no longer a threat to public health, and it aims to reduce the number of cases and deaths caused by cholera, and also to reduce social and economic consequences for affected countries, such as advocating for not instituting sanctions on countries because they have cholera or they reported cholera because of because that sanctions leads to a huge social and economic economic consequences to countries that actually are sanctioned. The focus of this task force is to emphasize on early detection and quick response to contain outbreaks of cholera, approaching targeted approach to improve prevention and control of cholera, and also coordination of human, technical, and financial resources. Next. These are the strategies that are put in place, or are put in place. Improve surveillance, If you remember, the first presenter was talking about failed surveillance leads to delay in actions taken to control cholera. If you have improved surveillance, you will be able to obtain quality data for risk assessment and early detection of outbreaks. Improved preparedness, this will allow us to provide a rapid response to outbreaks and limit the spread of the disease. Improved case management, this will definitely reduce mortality due to cholera. Improve environmental management to enhance prevention. Accelerated research to understand the burden of cholera and how best to manage the growing problem of drug resistance by the cholera bacteria. Use of available vaccines according to evidence-based guidelines, and also partnership with politicians, the media, and the community that are mostly affected by the cholera outbreak. Health education, focus on behavioral change, like what the earlier speaker mentioned, issues, and also the Honorable Commissioner Chairman of this occasion, talking about open defecation and also contamination of rivers and other sources of water. Next slide, please. Okay, with these strategies mentioned earlier, this strategy needs to be operationalized, needs to be implemented. This is usually done through a multi-sectoral approach. If you remember, when I talk about the stakeholders, they are from different areas, different fields of endeavor, and all of them are expected to be part and parcel of the effort to control and prevent cholera. Operationalizing such strategies means we need to have a leadership and coordination center for cholera outbreak, and this is done to build strong preparedness and response strategies. If we have a correct leadership and coordination system, we'll be able to get ready to abate deaths due to cholera in our system. And for this leadership, everybody is supposed to be there. Unfortunately, in many places, in many states and countries like Nigeria, when you talk about cholera outbreak, you end up having the Ministry of Health being the sole organization or responsible. When you invite others, you realize other agencies may not necessarily be actively involved due to one reason or the other that we are going to see as a challenge for fight against cholera prevention and control in Nigeria. We talk about water sanitation and hygiene. Getting wash system is to ensure sustainable access to safe water and sanitation solution for population that are most at risk of getting cholera. Strengthening health system, doing that will improve readiness in case management of outbreaks. Surveillance and reporting to confirm suspected cases and track progress in the fight against cholera. Talking about oral cholera vaccine, also to prevent and protect communities. Community engagement, since communities are the major beneficiaries and also victims of cholera outbreaks, communities need to be fully involved and they need to take responsibility. This multi-sectoral approach to cholera outbreaks means that this issue of water sanitation, leadership and coordination, health system strengthening, community engagement, surveillance and reporting, as well as use of oral cholera vaccines must work hand in hand, and all stakeholders must be involved in this effort. When we talk about leadership, next slide please. When we talk about leadership, we aim to build a strong, sustainable preparedness and response strategy. Establishment of coordination teams at all levels, emergency operation centers, rapid response teams in states and in the country, national as well as the state and also local government, preparedness and response plans, resource mobilization, supplies and logistic arrangement, establishment of coordination and coordination of cholera treatment and rehydration center. Cross-border collaboration is also very important, and it has to be well led by and coordinated. Next slide, please. Water and sanitation, basic water supply, basic sanitation, as well as basic hygiene are very important. People should have access to safe water as close as possible to their place of residence. The source of water should not be far away that it will take you more than 30 minutes going and for a round trip to get access to water. And of course, the source water should be protected. Sometimes you even have the safe water, but the container you are collecting water is contaminated. So it's not only about source of water, it's also about where we collect the water and where we keep the water, how we keep the water, either protected or not protected. And the issue of hygiene, issues of hands, our clean environment, issues of our pit latrines, and how close those pit latrines are to our source of water, and also good preparations, hand washings, and soap and water for every household, as well as hygiene kits. Next slide, please. Of course, there should be, many times you have hygiene materials or equipment around you or source of water, but maintaining such sources of water to be clean is also a problem. So our wash system also seek to support management of such structures and operation as well as maintenance of such sources of water, sanitation and hygiene systems that are put in place around us. Social mobilization for communities to increase cholera awareness and also change our behavior towards beliefs and practices such as open defecations, among others. Many people in the rural communities will definitely not want to have toilets in their houses. Some will have toilets and they will dump well around the same place. Some will prefer to go to the river sites or farms to ease themselves. All these behaviors need to be changed, but we should note that this behavior cannot change in a day or because of an outbreak in 2021. It has to be a process and it will take time, but it has to start with proper community engagement activities. Strengthening health system, as I said, issues of training of having preparedness plans, also to localize case management and protocol guidelines based on what we have at our disposal in our health facilities, and also provision of medical supplies and consumables. Case management, timely provision of adequate and appropriate supplies, training of healthcare workers on what to do. Sometimes health workers, if they don't know what to do, it will lead to, if they don't know how to act on time, it may lead to increased case mortality. Supplies and storage of essential response products such as ORS, antibiotics, soft water for disinfection, reporting of deaths and safe barriers. This is very important because our culture, people tend not to believe that they shouldn't be exposed, even if it is their first close relative that died. They must practice safe barriers, especially in epidemic or an outbreak situations. Health education and promotion should be anchored by the health system to better improve the outcome of cholera outbreak preventive measures. Next slide. Surveillance. An effective routine surveillance and laboratory capacity at peripheral levels is very important in order to be able to confirm cases, inform the response, and track progress towards prevention and elimination of cholera. Of course, effective surveillance system will help to provide reliable and timely data to detect outbreaks in both endemic and non-endemic areas. It will also help to monitor morbidity and mortality trends and also identify hotspots in endemic areas. But this surveillance system will never be complete without a functional laboratories. These laboratories should not be located in Abuja and Ibadan alone. It should be available in most of the regions in the country, if not all states, so that a timely diagnosis can be confirmed and action can be taken to understand the strains that is in circulation, also characterize and monitor outbreaks and determine new and evolving strains of the virus, of the bacteria. Next. These are very important issues to support effective surveillance system. Existence of standardized case definitions, data collection that is very simple for every person responsible to understand and also treat correctly. Clear reporting procedures, analysis plan, rapid diagnosis of suspected cases, RDTs and laboratory confirmation, feedback based on the surveillance data, and also coordination at all levels. These are very necessary for us to be able to have an effective surveillance system. Next. Oral vaccine. I don't want to go too much into this presentation, but it's suffice to say that there is positive association between the active use of oral cholera vaccines and protection against cholera. WHO supports this and they make an investment case for cholera or cholera vaccinations in the world, meaning that making case for the number of cases that will be abated. Next slide. The number of cases that will be abated, the number of deaths that will be abated, the economic gain, the cost of cholera that will be also protected. But it's always important for us to note that availability of vaccine for us to use must be justified. Why? Because cholera is no more a threat to developed nations. So what do? If we want to make a case to get vaccines for cholera to Nigeria or other developing nations, you must justify what is the global burden of the cholera, what impact the disease have on the larger economy, who should cholera vaccine be targeted for, which countries are likely to benefit, how should cholera vaccine stockpile be used, and how large should it be, and other questions that are very important to funders of most of this project, because so many countries will not be able to afford the cost of education, cost of health, environment, and so many other competing issues in the countries. So, of course, we know that most of the vaccine through Gavi, Global Vaccine Alliance, some funders need to be fully convinced that they need to provide the funds for a vaccine for countries, especially in diseases like this. So I believe the way forward is for us to be able to have our capacity and build our system to be able to develop our own vaccines for diseases that are of interest for us. Next slide. Next. Okay, very important. In Yemen, one Amina Ali, who is a beneficiary of UNICEF cash transfer, mentioned that we don't have good sanitation infrastructures and we need more support. The effort of the community volunteers are appreciated by the entire community, and this is important for us to learn how to prevent and protect ourselves from diarrheal diseases. This is in an effort to talk about cholera outbreak in Yemen, which is one of the countries ravaged by conflicts over almost 2 decades. And cholera outbreak is being targeted or supported through community efforts. An epidemic of cholera can be more quickly controlled when the affected population knows how to protect themselves and their relatives, and the community is fully engaged to limit the spread of the disease, as well as when an enabling environment exists for those protective behaviors to emerge. What is happening to... Okay. Maybe I can still continue. This is to highlight the importance of community engagement. Community engagement, unfortunately, is not a one-time event. It's not a one-time event, it has to be a process by carrying along the communities to first of all understand what is the issue, how are they responsible for the occurrence of cholera, how are they contributing to the spread of the disease, what can they do in order to protect themselves, protect their immediate family, and also the community where they live. This is a process, and it has to be done carefully, with careful understanding of looking at the environmental, political, and as well as social context. It also needs to take all the stakeholders within the community along in order for them to be able to work closely in order to play their roles to protect themselves, their communities from cholera. It's important to note that you need to identify, in cases of cholera outbreak, you need to identify volunteers that will be able to promote best practices of hygiene and sanitation. These practices are very important and necessary to prevent spread of cholera. For example, issues of open defecations. You need to have volunteers from respective communities to talk to their own people and get them to change their behaviors over time from open defecations in the fields or in the streams or in shallow, unsafe household latrines to a proper latrines that is safe for such disposal of waste within their community and at their level of development. Safe disposal of other waste, hand washing, regular hand washing whenever they visit toilet facilities, and also safe management of water supply chain from sources to point of use. Safe management of all waste, solid and as well as waste water in the community. There are things that we usually used to forget when it comes to issues of water. We have food vendors within the community. We all eat in cafeterias. Are these cafeterias attendants, food vendors screened regularly? Are these food vendors certified to be healthy, to be able to cook food and sell to us? How about the water vendors? We all know, due to failure of a lot of systems at different levels, communities tends to depend on water vendors that will be carrying water on the jerrycans. How clean are those jerrycans? What happens to the water? You may have a very clean source of water in a borehole, for example. I'm not an advocate of borehole, but you may have a borehole in an environment, and then the vendor that will go and pick the water and sell to you may not have clean containers, and it's also a risk. When you have a community that is fully engaged, they will be able to support the issue of effective management of water, hygiene, and sanitation facilities around them. Sanitation, public-private partnership is also very important when it comes to issues of hygiene and sanitation, as well as water supply to the communities. Adhering to the hygiene when caring for cholera patients is also very important, especially for the immediate caregivers as well as health workers. People caring for patients should be able to wash their hands and also be careful in handling feces, soil beds, and clothes of patients. Reporting deaths as well as organizing safe burials is very important by each community and must be emphasized during each level of community engagement for cholera outbreak prevention. Who are the actors for this community engagement? But at all levels, national, local, and community levels, water sanitation authorities and suppliers, local health and education and housing authorities, traditional religious leaders, women and men organizations, youth and girls, boys and girls, trade association, as well as media. all are supposed to be involved in community engagement processes for cholera outbreak prevention and control. Next slide. I would like to talk briefly on a regional effort, which is called Regional Cholera Platform in West and Central Africa, shortly WCA. This platform was launched in 2012, and it takes part in global effort toward cholera elimination through the operationalization of a regional, multi-sectoral, and evidence-based strategy that aims to prevent, stop, and mitigate the spread of cholera through the coordination of multiple actors involved in cholera prevention and control within this West and Central African sub-region. Part of the activities of this platform was a meeting, a cross-border meeting in Douala, the Republic of Cameroon, in October 2016, where efforts were made to contribute to the improvement of cross-border collaboration between the countries of the Lake Chad Basin in cholera outbreaks. The outcome of that meeting was to support the integrated disease surveillance and response based on the Abuja commitment of 2010 by the member nations, also involvement of focal point and IDSR focal person for cross-border meetings on polio as well as cholera prevention in the region, and so many other recommendations, including encouraging the use of oral cholera vaccine as an additional tool for cholera control in cholera hotspots. Also issues of stepping up advocacy for mobilization of resources, both technical and financial, towards emergency funding of emergency response for cholera outbreaks. That meeting, I'm almost there. That meeting was very educative and important to West and Central African regions. And Nigeria operationalized these various strategies by establishing what is called National Strategic Plan of Action on Cholera Control in 2018. And the NCDC, Nigerian Center for Disease Control, coordinates all preparedness and response activities for cholera control in Nigeria, and they support states with technical and other logistics for effective case management, case detection, surveillance, and response activities. Primary Health Care Development Agency at the national as well as state also support vaccine drive for cholera control. Emergency operating centers are always activated at the national and state level and being supported in other stakeholders like Ministries of Environment, Housing, Education, thinking that the whole problem lies on the Ministries of Health. Technical constraints, including shortage of staff, funding constraints, limited vaccine, IV fluids, and other drugs and other consumables, among others. Advocacy to leadership, budgetary allocation, training, and improvement in surveillance and preparedness are key solutions to some of these challenges. You have a role to play as a policy maker or politician. You support a transparent use of information to media and the community. As a community leaders, you also have roles to play. As a philanthropist, you can support and fund various activities at state and local governments level, even in your own immediate community. Healthcare providers will also make efforts to give their own best during outbreaks of cholera. As a community member, we should support government's efforts towards controlling and preventing cholera outbreaks and other infectious diseases, and volunteer ourselves to support some of these activities at all levels and all the time. With this, I come to the end of this presentation, but lastly, I would like to tell us that in year 2000, South Africa had a case of over 106,000 cases of cholera, more than half of what happens globally in that year. But they were able to contain it and reduce and contain the deaths to only 254 people, which amount to 0.2% of cases. This is done and achieved through a very good coordination system, interministerial committees, task force, joint operation committees, and technical support. This leads to the fact that South Africa was never sanctioned, even as of the year 2000, because of the effort they were able to make to contain cholera. This can be replicated in Nigeria and in Sokor and many other developing countries because of the improvement in the expertise and the facilities in these countries. But nevertheless, we should note that medical intervention will solve but none of this medical intervention will solve the underlying issues leading to cholera outbreaks. Cholera is a waterborne disease, and the risk of transmission is higher when there is poor sanitation and disruption of clean water supply. The wrong disposal of refuse and practices such as open defecation endanger the safety of water used for drinking and personal use. This leads to the spread of waterborne diseases such as cholera. Without proper water, sanitation and hygiene in Nigeria, Nigeria remains at risk of cholera cases and deaths now and in the future. May God protect us. Thank you very much for listening. Thank you very much.